Welcome to the We Talk Health Podcast, the official podcast for West Tennessee Healthcare. Please be advised that this podcast is not intended to replace any medical advice. Always follow your medical professional's advice and direction. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions, please reach out to us at wetalkhealthpodcast@gmail.com, and we will do our best to answer any questions you may have.
Welcome to another episode of We Talk Health. My name is Kwasigroh, and joining me in the studio today is the Camden Hospital CEO, newly appointed Camden Hospital CEO, Miss Ruby Kirby. Miss Kirby, how are you?
I'm good, and you?
Good. Thank you so much for coming in today. Congratulations on your new appointment to the Camden Hospital. That's amazing.
I'm excited, looking forward to it. I've been up to Camden a lot, working with them with Joint Commission. Mm-hmm. They have a wonderful group up there, so I'm looking forward to working with Camden.
Well, I think you're going to do an amazing job up there. And you're also the CEO at Bolivar Hospital as well.
That's correct.
So you're double dipping there a little bit. That's great. So how long have you been with the West Tennessee Healthcare team?
Actually, October the 29th, it'll be 42 years.
42 years. Wow.
42 years.
Wow, that's amazing. What's been your favorite part so far?
You know, it's a wonderful system to work with, and I've been in on both sides. I started here at West Tennessee Healthcare at the main hospital, Jackson General, nursing, and was here 20 years. 20 years. Came straight from Union University. I worked as a PCT when I was in school, and then I was a staff RN, and then went into nurse administration.
That's amazing.
So I was here 20 years, went to Bolivar in 2000, got to see what rural health is all about, and it is an interesting difference, but I have really enjoyed it. You get to work more closely with the community than I was here, so, we look at what the community needs and get a lot of input to run these small hospitals.
Sure. That's great. So we'll talk about Camden for a little while. So how many beds are offered at Camden Hospital?
Camden is a critical access hospital, so it's licensed for 25 beds.
25 beds, okay.
25 beds. And we may run an average daily census, of course, of about 2 to 3 patients a day.
Okay.
Their specialty is swing beds, which is a lot like inpatient rehab in a nursing home. They can take patients in that need rehabilitation. So they see quite a few rehab patients that are counted into 25, but it's a different type service.
Okay. How many beds are in the ER?
Their ER has 5 beds.
5 beds? Okay.
5 beds. They see anywhere from 20 to 25 patients a month through that, about 5,000 patients a year.
Okay. How many patients do you guys see annually? But you just answer that. So
through the ER, and then total, they see about 10,000 patients a year.
Okay. So what services are offered at Camden Hospital?
Oh, Camden has a wide variety, and I think some of them are the best kept secret. They do inpatient, of course, swing beds in the emergency room. We've talked about that. We have a 24-hour physician coverage because we have hospitalists. They have a radiology department that does CT scans, mammograms, ultrasound, bone density, and they have a contract service that come in and actually do MRIs up there.
Okay.
So they have that. Of course, they have respiratory therapy, EKGs, Holter monitors, have a physical therapy department, inpatient and outpatient laboratory, and APT department does inpatient and outpatient.
That's amazing.
They have a sleep lab that they do inpatient and in-home studies. So they do have that. They have a dietitian that does outpatient nutritional counseling. So she works in the community. And, we're looking for other services that the community need to add.
So why should people in the Camden area choose Camden Hospital for their healthcare needs as opposed to going elsewhere?
Well, Camden, we take care of the patients and diagnoses that we're qualified to take care of. The one thing about going to your community hospitals are when you come in, people know you. And they're going to go above and beyond to take care of their neighbors because many of these people go to church with them, go to school with their children. Camden is fortunate that a lot of their staff are they're from that community, and they've been there for a while. So they're very qualified to take care of it. And, it's close to home. They don't have to travel.
That seems to be
that
seems to be the unofficial mantra of West Tennessee Healthcare lately is care you trust close to home.
Yes, close to home.
That's amazing.
It's easier and people get better care when they're close to home because, you don't have to travel. And we find that patients have a tendency to cancel appointments when they have to travel a long distance.
Sure.
So we can do it there.
Absolutely. So where is the hospital located in Camden?
Oh, you would ask me that. Being a woman, I don't know. You go down I-40 and I take exit 126 and take off.
I got you. So, yeah, if you're listening and you need to know the address, it's going to be in the description of the podcast.
So the other thing about Camden is, like I said, everybody knows the community. They're going to go above and beyond. And if we can't take care of you, we're going to make sure we get you to the next level of care. But Camden has an excellent patient experience scores. Their scores are always high. Their hospital-acquired infection or anything to cubitus is at 0. They don't have hospital-acquired conditions.
Okay.
So when you come in, you're not going to, get any kind of infection. They don't have falls because of the care that they give. And we have physicians that are there available 24 hours a day. So anytime you're having any kind of opportunities, physicians can respond quickly. And it's a consistent group that works there. Our emergency room is open 24 hours a day. They're well staffed. They have excellent equipment. We have 24 hours a day respiratory therapy there. So anytime you need anything, we can either give it to you or get you to the next level of care quickly versus bypassing and, getting sicker on your way or even having negative outcomes because you bypass a small community.
Sure.
A lot of people don't think about this in these small communities. And like I said, we got well-qualified staff that works at Camden. PT department, the physical therapist has been there for several years. They have an excellent reputation also. So all the way around, and then if you come and you get hungry, they got wonderful food up there.
Well, there you go. Can't beat that.
Can't beat that.
Ms. Kirby, thanks so much for coming in today. This has been great. And if you're living in the Camden area and you're wondering where you should have your health care needs taken care of, don't hesitate to reach out to Camden Hospital. Like Ms. Kirby said, they are very, very well qualified people and individuals that really do care about you. So don't hesitate to reach out. Their address is 175 Hospital Drive in Camden, Tennessee. And like I said, that will be in the description of the podcast if you're looking for it. Ms. Kirby, thanks so much for coming in today. This has been great.
Thank you.
Absolutely. And this is another episode of We Talk Health.